Thank you so much. So, first of all, I want to say that I'm happy that we get to stand here in the middle of the room instead of being on one side of the room, standing on a elevated stage behind a podium looking down on people, because I believe that in order to have a shared experience, which is what we try to do here at Voices, is to first change your positioning in order to be close to people, to be able to walk around, move around, and get to know people. So first of all, I just want to say, thank you for booking this room because we get to stand in the middle. I love this. But back to my speech. Okay. So how many people here know how to communicate through sign language? You don't have to be fluent. Anybody? There we go, Miss Johnson. Rave it high. Be happy about that. All right. Well, how many here can communicate their intentions and their feelings through facial expression or gesture? Raise your hand. Okay. All right. So much more of us. You, my friends, are what speech language pathologists would call multimodal communicators. Good for you. Okay. In fact, put that on your resume. I mean, we all are, but it sounds so good. Multimodal communicators. Multimodal, yes. So my connection with sign language and the deaf ministry, I would say, came through my mom. She was always interested in it. She's not deaf. She's not hard of hearing. There's nobody in our family who is deaf and hard of hearing, but she was interested in it, and I guess it imprinted onto me because we both took sign language courses, and we both met different people who are deaf and hard of hearing in the deaf community around Dallas and Mesquite. And so I guess you can say we dove into the deaf community and the deaf culture. And so that led me to audiology, which is the science of hearing, and that led me to speech language pathology, which is the science of communication disorders. And so here I am with the School of Health Professions. The School of Health Professions, we have many different programs that's a part of our school. We have physical therapy, occupational therapy, we have physician's assistant studies, we have respiratory care, we have medical laboratory sciences, we have emergency medical care, we have even more than that. And so let me tell you about speech language pathology, because I bet a lot of you here don't know what that is. So, a speech language pathologist or an SLP is a clinician and or a researcher who delves into five different areas: speech, language, cognition, hearing, and swallowing. Yeah, swallowing disorders. Yeah, we do that. And so not everybody can do it naturally, not everybody can do it safely. And so who you going to call? Your local speech language pathologist. Thank you. Uh, and so, oh, by the way, I do have to mention that you are looking at a male speech language pathology student. That's rare, okay? Extremely rare. Um, Out of all the nationally certified speech language pathologists, only 4% are male. 4% in the entire nation. And so out of the 51 students who are speech language pathology students here, 2 are men. I'm one of them. And there's Matt, Mr. Skydiver. He's number 2. 100% of us showed up to this tonight. Represent. so, so as I was saying, that I mentioned that there's a lot of different programs in the School of Health Professions. And so you may think, okay, so they're separate, they all do their own little thing. No, we all have our own little areas, but we all still work together. That's why we're all School of Health Professions. And so you may think, how can you all do the same, work together? Well, let's think of a scenario. We have an elderly man who had a severe stroke, and he fell, and so he hurt his hip, and so he has to go to the hospital. So how can all of those different pieces of the School of Health profession help this one man? Because his quality of life for him is to wake up every morning, read the newspaper, and drink a cup of coffee. Okay, when he was in the hospital, we had medical laboratory science who did his clinical test. They probably did a blood glucose level test, urine dip, so they can make sure that they can clear him for diabetes. You have to put sugar in your coffee, right? Um, Also, he worked with a physician's assistant. And one on one, they spoke to him about how he can carefully manage his health. And a respiratory therapist. They make sure that that he has the respiration, that he has the respiration skills, muscles, ability, so that he can know first of all when he's too stressed and when to sit down and take it easy, and also how to stay alive. And whenever he gets home, we have a physical therapist who can make sure that he safely gets up and gets out of the bed in the morning and that he can walk outside to go get his newspaper. And once it's time to get the newspaper, he can bend over and get it. That's what physical therapy helps with. Occupational therapy makes sure that, well, first of all, he goes outside and he's wearing clothes, okay? Because I don't think the neighbors want that. And so, also, whenever he goes outside, he makes sure that he can unlock his door, that he can lock his door, that he can safely go and find his newspaper, and that he can make this coffee and pour hot liquid every morning. And then speech language pathology. How can we help? Well, as I said, we're into cognition. So we might have to help him with memory traits, different memory skills, and different ways so that he's not reading the same article over and over. And reading, there's two different parts to that. There's recognizing, identifying the words that you're reading, and comprehending what it's actually telling you. Phoneme, grapheme conversion, things like that. And also, we work with swallowing. So whenever he's drinking that coffee, we're making sure that he has the skills that he's not aspirating. Okay. And so that's how all of those different pieces can go together just to help one person read the newspaper, live his best life, and have his coffee. And how do people who are in the School of Health Professions help individuals live their best life? By first changing their positioning, getting closer to people, and finding out what they want out of life. That is allied health. That is the School of Health Professions. Thank you.